Before you swallow that little white pill this morning, there is something you need to know. Something your cardiologist probably never told you. Something that is sitting quietly in your medicine cabinet right now. And something that may be the real reason you have been feeling so tired, so foggy, so unlike yourself for the past few years. You have been blaming age. I am here to tell you, age is not the problem. I'm Dr. Christian O'Brien, board-certified in metabolic and preventive medicine. And after 15 years of watching patients over 60 suffer from symptoms that were never caused by their hearts, but by the medications meant to help their hearts, I cannot stay quiet about this any longer. Here is what I see in my practice, week after week. A man walks in, 71 years old, retired, used to be sharp as a tack. Now he forgets where he put his keys. His wife is worried. He is tired before noon. His legs feel heavy. He woke up dizzy twice last week and had to hold the wall just to get to the bathroom. His last doctor told him everything looks fine on paper. His blood pressure is controlled. His numbers are good. And yet this man, who used to fix his own car engine and do the New York Times crossword in ink, can barely finish a thought. He is not falling apart. His medication is doing something to his body that nobody warned him about. And that is exactly what this video is about. We are going to talk about 3 categories of blood pressure medications that research now shows carry serious, underappreciated risks, specifically for adults over 60. Not for everyone, not necessarily for you. But you need to know what to watch for, what to ask your doctor, and what these drugs are quietly doing inside your body when nobody is checking. Stick with me through this one. Because the third medication on this list is the one that surprises almost everyone, including many doctors, and it may be the one you are taking right now. Let us start with why blood pressure treatment in older adults is not the same game as blood pressure treatment in someone who is 42. Your body at 65 is a fundamentally different physiological system than it was 20 years ago. Your kidneys filter blood more slowly. Your liver processes medications at a reduced rate. Your blood vessels have less elasticity. Your nervous system responds to pressure changes with less agility. Every one of those changes affects how a medication behaves inside you. Think of it this way. Imagine you have a garden hose, and that hose used to be brand new, flexible, responsive. When you turned the pressure up or down, it adjusted immediately. Now imagine that same hose has been in the sun for 20 years. It is stiffer. It does not flex the same way. If you drop the water pressure too fast, the hose does not adapt. The garden does not get watered evenly. Parts of it dry out. That is what happens in the aging cardiovascular system when blood pressure drops too aggressively or unevenly. Certain tissues, including brain tissue, do not get the blood supply they need, and the damage is slow, silent, cumulative. This is the foundation of everything we are about to discuss. These 3 medications are not dangerous for all people at all ages. They become problematic specifically because of the way the aging body handles them, and that distinction matters enormously. Let us begin with the first category, and this one is probably the most commonly prescribed class of blood pressure medication in North America for adults over 60. We are talking about a group of medications called calcium channel blockers. These drugs work by relaxing the muscles in the walls of your blood vessels. When those muscles relax, the vessels widen, blood flows more freely, and pressure drops. Simple concept. And in theory, it sounds perfectly reasonable. The problem is, what happens when those muscles relax too much, too fast, particularly in older adults whose regulatory systems are already slower to compensate? The specific risk here is something called orthostatic hypotension, which is a complicated name for a frighteningly common and dangerous event. It means your blood pressure drops suddenly when you stand up. One moment, you are sitting in your chair. The next, you're reaching for the arm of the sofa because the room is spinning. In a 40-year-old with a healthy, responsive vascular system, that pressure drop corrects itself within a second or two. In a 70-year-old on a calcium channel blocker, that correction can take 5, 10, even 15 seconds to normalize. 5 to 15 seconds of reduced blood flow to the brain every single time they stand up. A study published in the Journal of the American Geriatrics Society followed over 4,000 adults aged 65 and older on calcium channel blockers over a 3-year period. They found that the rate of fall-related injuries in that group was nearly 40% higher than in the control population. Not slightly elevated, nearly 40%. Falls in older adults are not minor inconveniences. They are one of the leading causes of hospitalization, loss of independence, and death in people over 65. Now, I want to be absolutely clear here. If you are taking a calcium channel blocker, do not stop taking it on your own. That is not what I am saying. What I am saying is that if you have been dizzy when standing, if you have been lightheaded, if you have had near falls in the morning or after meals, that information matters and your doctor needs to hear it. What you are experiencing is not just aging. It may be a medication effect that has a solution. The second category is one that many of my patients have been on for years before anyone thought to question it. We are talking about a class of medications known as central alpha-agonists. These drugs work in a very different way from calcium channel blockers. Instead of acting on your blood vessels directly, they act on your brain. They tell your nervous system to send fewer signals that would ordinarily keep your blood pressure up. Think of it like this. Imagine your brain is the control tower at an airport, constantly sending messages to every part of the system to keep things running at the right speed. Central alpha-agonists essentially turn down the volume in that control tower. Fewer signals go out. Blood pressure drops. Sounds elegant. But here is what the control tower also manages: alertness, memory consolidation, mood regulation, motor coordination. When you dampen those signals in a younger person, the brain compensates relatively quickly. In an older adult, particularly one who is already experiencing age-related decline in those same systems, the dampening does not stay contained to blood pressure regulation. It spreads. The side effect profile of central alpha-agonists in adults over 60 includes cognitive dulling, depression, fatigue so profound it mimics hypothyroidism, and in several studies measurable decline in short-term memory function. A review by researchers at Johns Hopkins analyzed outcomes across 14 clinical trials involving adults over 65 who were prescribed this class of medication. They found that patients on central alpha-agonists for more than 18 months showed significantly greater decline on standardized cognitive assessments compared to those managed on alternative blood pressure regimens. Significantly greater, not a rounding error, a meaningful, measurable gap. I have sat across from patients who came to me convinced they were developing Alzheimer's disease, frightened, grieving the version of themselves they felt slipping away, and in more than a few of those cases, the decline was not a disease. It was a drug effect. When the medication was adjusted, with their primary care physician's guidance, the fog began to lift. That is not a miracle. That is just medicine being done more carefully. If you are someone over 60 who is struggling with mental sharpness, with memory, with feeling emotionally flat or exhausted in ways that do not match your sleep or your lifestyle, please, before you accept that as inevitable aging, have a direct conversation with your doctor about every medication you are on and what it does to brain chemistry. You deserve that conversation. And now, here is a good moment to pause and say, if you have found this useful so far, please consider subscribing to this channel. I put real work into every video here because I believe you deserve information that actually changes something. Now let us keep going, because we are not done. And the third item on this list is the one I promise you did not see coming. Before we get there, I want to tell you about a patient I will call Harold. Harold was 68 when he first came to see me. He had been on blood pressure medication for 11 years on 3 different agents, all prescribed by a well-meaning internist who was doing exactly what the guidelines said to do. Harold's numbers were controlled. His blood pressure averaged 118/74. By every metric on paper, Harold was a success story. In real life, Harold had not slept more than 5 consecutive hours in 4 years. He had developed what he described as a persistent dry cough that had been dismissed 3 times as allergies. His libido had dropped to nearly nothing, which was devastating his marriage. His potassium was borderline low at nearly every blood draw, and no one had connected that to anything. He had gained 22 pounds despite eating less than ever and walking 3 miles a day. He felt like his body had become a stranger. Here is something I want you to hold in your mind before we go to that third medication. Ask yourself honestly, is what Harold described, the fatigue, the brain fog, the weight that will not move, the symptoms that appeared quietly over years. Does any of that sound familiar? Because what I found when I reviewed Harold's full medication list, and what I am about to tell you now, is the piece of this conversation that I believe matters most. The third category is one of the most commonly prescribed medications in the world. I am talking about a class of drugs called thiazide diuretics. These are water pills. They work by making your kidneys excrete more sodium and water, which reduces the volume of blood circulating in your body, and therefore reduces the pressure on your vessel walls. The logic is completely sound. In younger patients, in short-term use, thiazide diuretics can be highly effective and relatively well tolerated. In adults over 60, particularly those who have been on them for years, the story is different. Here is the mechanism that does not get enough attention. When your kidneys flush out extra fluid, they do not flush out only water. They flush out electrolytes. Specifically, they flush out potassium and magnesium at an accelerated rate. Potassium and magnesium are not optional nutrients. They are the two minerals most directly responsible for the electrical stability of your heart, the health of your muscles, including the muscle that makes up your heart wall, the regulation of your blood sugar, and the quality of your sleep. A large prospective study published in Diabetes Care tracked nearly 9,000 adults over 50 who were taking thiazide diuretics long-term. After 4 years, the researchers found a 36% increase in new-onset type 2 diabetes in that group compared to matched controls on alternative antihypertensives. 36%. And the mechanism they identified was exactly what I just described. Chronic low-grade potassium depletion impairs insulin secretion from the pancreas. You are treating your blood pressure, and you are quietly destabilizing your blood sugar at the same time. There is more. A Harvard School of Public Health analysis of diuretic use in adults over 65 found that prolonged thiazide use was independently associated with higher rates of muscle cramps, cardiac arrhythmia, and what the researchers called metabolic syndrome progression, which means the cluster of problems that include central weight gain, elevated triglycerides, elevated blood sugar, and worsening blood pressure over time. In other words, the medication meant to improve the cardiovascular picture was, in a meaningful subset of older patients, making the overall metabolic picture worse. Harold's unexplained weight gain, Harold's disrupted sleep, Harold's borderline potassium levels at every blood draw. Harold had been on a thiazide diuretic for 9 years. When we worked with his primary care doctor to transition him off that specific agent and onto a potassium-sparing alternative while aggressively restoring his electrolyte levels through diet, something remarkable happened. Not overnight, over about 4 months. His fasting blood sugar dropped from the pre-diabetic range down to completely normal. His sleep improved dramatically. 4 to 5 hour nights became 7 to 8. The cough, which turned out to be a side effect of a different agent entirely, was addressed separately. He lost 14 of those 22 mystery pounds. And the last time I spoke with Harold, he told me he felt like he had been living with a foot on the brake for a decade, and someone had finally lifted it. Harold's case is not unique. I have seen versions of it dozens of times, and I want to be honest with you, as I always try to be in these videos. Not every person over 60 on a thiazide diuretic is going to have this experience. Some people tolerate them beautifully for years. The point is not that this medication is evil. The point is that if your body is sending you signals, and your doctor is attributing everything to aging, the medication deserves a serious second look. And please, everything I am sharing here is information to bring to your own doctor, not to act on alone. I am not your physician. I do not know your full history. What I am is a doctor who believes deeply that an informed patient is a safer patient, and that you have every right to ask hard questions. Now let us talk about what you can actually do with everything we have covered. If you are on any blood pressure medication and you have been experiencing unexplained fatigue, cognitive changes, muscle cramps, disrupted sleep, weight gain that does not respond to diet, dizziness when standing, or depression that appeared after starting a medication, that symptom pattern is a conversation. Write those symptoms down. Bring them to your next appointment. Ask your doctor specifically, could this be a medication side effect? And if so, what are the alternatives? You are not asking your doctor to stop treating your blood pressure. You are asking for a complete picture of the trade-offs. Have your electrolytes checked if you have been on a diuretic for more than a year. Ask specifically for potassium and magnesium levels. Those numbers do not always make it onto a standard metabolic panel, unless you ask. If your magnesium has never been checked, ask for it today. Ask your doctor about orthostatic blood pressure testing if you have had episodes of dizziness when standing. This is a simple test done right in the office. Your blood pressure is measured lying down, then immediately after standing. A drop of more than 20 points systolic is considered significant. If that number has never been measured, it is worth knowing. Consider having a detailed medication review with a clinical pharmacist or a physician who specializes in geriatric or metabolic medicine. This is especially important if you are on 3 or more medications and are experiencing unexplained symptoms. Polypharmacy, which is the term for being on multiple medications simultaneously, is one of the most underappreciated sources of harm in older adults, and it is almost always addressable with the right eyes on your chart. And do not underestimate the role of diet in blood pressure management. A diet consistently rich in potassium from foods like leafy greens, avocados, sweet potatoes, and legumes acts as a natural counterbalance to many of the mechanisms we discussed today. Magnesium from pumpkin seeds, dark chocolate, almonds, and whole grains supports vascular tone and insulin function in ways that no pharmaceutical can fully replicate. These are not replacements for your medication. They are amplifiers of your health that reduce the dose burden your body has to carry. Here is what I want you to take away from everything we have covered today. Blood pressure medications have saved millions of lives, and they will continue to. But they are not neutral. They are not passive passengers in your body. They interact with your kidneys, your brain, your muscles, your hormones, and your electrolyte balance in ways that change over time as you age. A medication that was perfectly calibrated for you at 55 may be creating a slow-moving problem at 68 that nobody has connected the dots on. You are not just a set of blood pressure numbers. You are a person who wants to think clearly, sleep well, move without pain, and feel like yourself. Those goals are medically legitimate. They deserve to be part of your treatment conversation just as much as your systolic reading does. The 3 categories we discussed today, calcium channel blockers and their orthostatic risk, central alpha-agonists and their toll on cognition and mood, and thiazide diuretics and their long-term effect on electrolytes and metabolic health, are not reasons for panic. They are reasons for questions, smart, specific, informed questions that could genuinely change the trajectory of how you feel for the next decade. If this video helped you see your own situation differently, I want to ask you something personal. Think of one person in your life, a spouse, a sibling, a close friend over 60, who has been struggling with fatigue or brain fog and just accepting it as part of getting older. Send this video to them. Not as a forwarded link, but with a note. Tell them you thought of them specifically. That small act of sharing accurate information could give someone they love back a version of themselves they thought was gone. If you are new to this channel, please subscribe. I cover these kinds of topics every week, the things that matter for health over 50 that most people do not hear about until it is too late to act on them. And in the next video, we are going to talk about something that connects directly to everything we discussed today. We covered what these medications are doing to your electrolytes and your metabolism. In the next one, we are going to go deep on what you can do in the next 30 days, with food alone, to measurably strengthen your cardiovascular system from the inside out. You will not want to miss that one. I'm Dr. Christian O'Brien, and I'll see you in the next one. Take care of yourself.